Excellent. Well, once again, thank you all for joining. Excited that you are here for Decarb Healthcare. I am going to share my screen and we will get started. I believe, Jess, you're going to hit record. Great. Well, thank you and welcome.
Recording.
Welcome everybody to Decarb Healthcare. This 1 hour session is eligible for AIA credits. And so Mazzetti is a registered provider with the American Institute of Architecture, Continuing Education Systems. Credit earned on completion of this program will be reported to CS Records for all AIA members. Certificates of completion for non-AIA members are available upon request. And again, this program is registered with AIA CES for continuing professional education. And because it is, there's this copyright notice as well. We have an exciting lineup for you, and so excited to have you all here. We have introductory remarks. You'll hear in a moment from Walt, Robin, Daniel, and Bradley. Austin will give us an overview of the Decarb Healthcare program. And then we'll hear our keynote addresses from Dr. Dick Jackson and Dave Lockhart. Then we'll have a project overview, an intro to Decarb Healthcare, an online platform and community. And then we'll hear from Dave Mason of OshPod. All right, without further ado, we'll hear from Walt Vernon.
All right, thank you, Troy. So I have no slides. You just have to listen to me for a second. I just wanted to, first of all, thank the team of people, including Troy and Cassidy and Austin and Jessica, who really, and Jim at Mazzetti, who've put this program together and have been running it to date. And I think it's a really exciting initiative from the California Energy Commission. Last week, the International Federation of Healthcare Engineers passed a resolution calling on the global healthcare sector to reduce its footprint 50% by 2030. And for those of you who followed this, last summer, the National Academy of Medicine here in the United States did the same thing. They're now launching what they're calling a grand challenge to help decarbonize the healthcare sector. So this issue, the healthcare profession is calling on us to respond. And I have to say, I watch my little engineering firm, and we're now designing projects around the country, and we're designing them the same way we've been designing them largely for the last however many years, with big boilers and big diesel generators and big fossil fuel things that are going to continue to spew CO2 for decades. And we need a better way. And I think in our profession, we are designers. And I think we have a moral imperative to do better and not just do the same old thing. And I'm really excited that the CEC has created this opportunity for us to come together as a profession and write a new book for how to do it better. So with that, I have to shut up and let others talk.
Great. Thank you so much, Walt. We'll turn it over now to Robin Rothman, who is speaking on behalf of Healthcare Without Harm.
Hi, everyone. Thank you for having me today. My name is Robin Rothman, and I'm the Associate Director of State Policy Programs at Healthcare Without Harm. If you're not familiar with us, Healthcare Without Harm is an international nonprofit that works with hospitals in 70 countries to reduce its carbon footprint, build facility and community resilience, and become leaders for advocating for climate smart policies. As the only sector with a healing mission, we must first do no harm in our own operations as well as with our services. The evidence is clear that we must decarbonize. In 2019, we published a study with Arup that found that healthcare's climate footprint globally is equivalent to 4.4% of all emissions. So if healthcare was a country, we'd be the 5th largest emitter on the planet. In the US, which of course leads in our emissions versus any other country from the healthcare sector, The number's even higher. Healthcare is responsible for 8.5% of all US emissions, and hospitals are about a third of that. All of you understand the unique energy needs and requirements that contribute to this footprint, but it doesn't have to be this way. We all also know that the impacts of climate change are already here and getting worse each year. 2020 was yet another record-breaking billion-dollar climate disaster year, according to NOAA. Every year it gets worse and worse. In California, we have some of the national leaders in healthcare mitigation and resilience that Walt and I are very privileged to work with. I lead the California Healthcare Climate Alliance, which is a coalition of the 5 largest health systems in the state, all of whom have set ambitious greenhouse gas reduction goals. And they actively support policy and regulations to support this work in order to protect the health of their patients and their communities. None of this transformational change that's necessary to decarbonize is possible without all of you. The expertise and knowledge that you have is crucial in order to test the feasibility of new innovations, as well as ensuring that the regulatory maze allows you to do the work that we need to do in this space. We are thrilled about this initiative, bringing together engineers, facilities, managers, and regulators to help us solve these problems. And we look forward to supporting this work as we move forward. Thanks.
Robin, thank you so much, and thank you for your support. Next up, we'll have Daniel Mendonça from UC Davis Health to provide a few words of introduction. Thank you, Dan.
Hi, my name is Dan Mendonça. I'm the energy manager with UC Davis Health. We've got about 4 million square feet of facilities we're dealing with currently, and looking at adding online another 2 to 3 million over the next 10 years. And we're part of a health system throughout California with 4 other sister facilities in Southern California, Central California, and Northern California. We have goals at UC to be net zero by 2025. And there are many challenges to get there. And with new construction, that means no new fossil fuels associated with heating. We currently have a hospital in Irvine being designed that's going to be all electric. But there are many challenges to getting there, and also with operating and maintaining and reliability. So while we can get to net zero, we need to do it in a way that's going to keep our patients safe and make it easy to maintain. And we really need your help to get us there. Thank you.
Great. Dan, thank you so much for highlighting that this community needs to help your organization to meet its decarbonizing goals. Next, we're really excited to hear from Bradley Meister from the California Energy Commission. Go ahead, Brad.
So good morning. I'm Brad Meister, a senior engineer with the Buildings Group at the California Energy Commission. I wanted to welcome everyone and just make a few brief comments on why this workshop is so important. You know, healthcare buildings, including hospitals, are the 2nd largest consumer of energy per unit of floor area of all building types, using about 2.5 times more energy than other commercial buildings. Healthcare-related greenhouse gases in the US increased 30% between 2006 and 2016. Many healthcare buildings in California have a high demand for building heating energy, high hot water distribution system losses, and even poor boiler operational efficiency. This project provides a comprehensive and interactive guidebook on existing and emerging energy efficiency equipment and systems. The input from this workshop and others that will follow is intended to aid California hospitals in the planning and design of retrofit projects as part of a long-term strategy to help decarbonize California by 2045. I thank you very much for participating and taking your time today, and look forward to the workshop. Thank you very much.
Great. Brad, thank you very much. And thank you to all of our introductory speakers. I think you've done a great job of setting out the challenge. And now I turn it over to Austin Berlin, who will talk about the program. Austin.
Thanks, Troy. I'm Austin Berlin, Senior Energy Analyst at Mazzetti. So today, the healthcare design community has an important opportunity to change the trajectory of our facility's carbon footprint. As Walt mentioned, I just need to reiterate this. By continuing with the status quo and designing and building hospitals with fossil fuel powered boilers and equipment, we're essentially locking in another 40 to 50 years of carbon emissions with that equipment. The EPA says that carbon dioxide stays in the air for 100 years. So what we do today will essentially impact the next 4 generations of people. 3 weeks ago, I became a father, and that really gave me a new perspective on how what we do today will impact my son's generation and future generations. It's really powerful what opportunity we have today that will really change the future. So that we, as the design community, healthcare leaders, and everyone here, we have a responsibility to act now, must come together, think bigger, and change the way we design hospitals of the future, and also operate hospitals that exist today. You know, as Bradley mentioned, the CEC, the California Energy Commission, has recognized the urgency of this issue and is funding grant research and development of the guidebook for decarbonizing healthcare facilities. The goals of the grant are to identify advanced technology solutions that will help hospitals reduce or eliminate the use of natural gas for space heating, water heating, sterilization, other uses. Also to collaborate with hospital engineers, designers, state regulatory agencies, healthcare nonprofits and organizations, among other industry professionals, to ensure that that guidebook will be an effective tool to implement those technologies. And lastly, to provide a resource to identify pathways and incentives towards decarbonization. It's really a community effort that we all need to come together and work together to do this. So ultimately, that's how Decarb Healthcare was born. Decarb Healthcare is an online platform. You know, Mazzetti is the host of this grant, and we not only wanted to write a guidebook for decarbonizing technologies, but we wanted to build a living resource, a platform that will be ever changing as technology changes, as well as developing a community to accommodate new and future technologies and maintain relevance beyond the grant term. The term of this grant is 4 years. So in 2023, the grant will be finished up, but we want to continue this long after that. And we can do that by crowdsourcing ideas, experiences, research, knowledge, to then curate that content into a practical guidebook that will encourage and promote decarbonization of healthcare facilities across the country and across the world. And we can do that. We can only do that with all of your support. I see 94 people on today, and I'm ecstatic that we were able to reach that many people, and that you're all here because you share the same passion that we do for this effort. So today we're going to hear from some exciting keynote speakers, and then we'll also show you exactly how you can participate to make a difference. Thanks, Troy.
Thank you, Austin. I have now the distinct pleasure of introducing Dr. Dick Jackson. Richard Joseph Jackson is a professor emeritus at the Fielding School of Public Health at the University of California, Los Angeles, where he was department chair in environmental health science. A pediatrician, he has served in many leadership positions within the California Health Department, including the highest as the state health officer. For 9 years, he was director of the CDC's National Center for Environmental Health, and he has received the Presidential Distinguished Service Award. In October 2011, he was elected to the National Academy of Medicine of the National Academy of Sciences, this country's most prestigious scientific establishment. Professor Jackson was instrumental in establishing the California Birth Defects Monitoring Program and in the creation of state and national laws to reduce risks from pesticides, especially to farm workers and to children. He has too many awards to list, among them the Henry Hope Reed Award for his contributions to architecture, and the Cedric Memorial Award, the highest award of the American Public Health Association for distinguished service. He's co-authored several books. He's even hosted a PBS special. He speaks on this topic to Congress, state legislatures, and we are excited to have him address the Decarb Healthcare Kickoff. Without further ado, Dr. Jackson, the floor is yours.
Hi, Troy, and thank you. It's such a pleasure to be with you all. Doesn't this picture kind of capture what we're dealing with at the beginning of the third decade of the third millennium? Wear your mask, worry about lots of other things. Next, please. On the morning of September 9th, I live in Berkeley, and the sky was red. I thought I had awakened on Mars. I checked the air quality, and the yellow dots mean it wasn't bad. And the smoke levels were a mile or so over our heads that was really moving. And as I'm studying that website, next please, I backed it out and realized that there was a plume of soot, PM 2.5, volatile organics, and lots of other stuff blowing both out to the Pacific, which was turning around, coming back over us, but also across the North American continent and towards Greenland and Europe, depositing ash all the way along the way. Next, please. I was early in my time at CDC and I had to go to the White House often. The head of the Office of Science Technology Policy, Dr. Bob Watson, one day I was talking about MTB and gasoline. He says, well, that's important, but I'm going to show you what's really important. And I kind of knew this, but he laid out the upward tick of CO2 in the atmosphere as measured in the so-called Keeling curve. And it struck me that this looked an awful lot like what I saw when I was working in the intensive care nursery at UCSF. And if you had a baby who was increasingly retaining CO2, it would spike up and down as they were breathing. And the planet's atmosphere looked like a patient in the ICU who was dying. Next. As I began to learn more about this, and you all know this, the sources of our CO2 in the atmosphere are largely from electricity and heat production, transportation industry, and other sources, buildings being a big contributor overall. 6% of all the CO2 loading in the atmosphere of the planet is from baking limestone at extremely high temperatures in the process of making concrete. And suddenly, what we're doing in the atmosphere, how we're buildings, it began to really hit me that this was a health issue just as much as any disease that we're looking at. Next, please. And that Keeling curve, the increase in CO2 in the atmosphere has correlated with an increase of the temperature of the atmosphere. And by the way, about 80% of the heat goes into the oceans. But this is a combination of land and ocean. And this zero line is normalized to the 20th century average temperature on the planet. And you can see before about 1940, virtually every year was quote unquote below average temperature. Until about 1960, it oscillated up and down. And by 1980, we've never had a colder than average year. It means my sons, who are now in their late 30s, have never lived in a colder than average year. It also means that my granddaughter, who's now almost age 5, has lived in the hottest years ever recorded in the last 140. And my brand new granddaughter, unlike Austin, when you have a young child, you suddenly deeply realize that the importance of the trajectory you're on, not simply the static condition one is in. Next slide. This is using one of the satellites, NOAA global temperature, and there's one thing and many things to talk about in this one, the melting, the heating of the boreal forest, particularly over Siberia and northern Alaska. It doesn't quite show in this one, but that blue spot below Greenland, to the southeast of Greenland, always kind of fascinated me. Why would it be colder in the ocean in that area? Next. Well, the first time the top of Greenland had ever completely melted that at least humans could detect was in 2012, and now pretty much every year it melts, and these rivers of fresh water are pouring down the moulins and into the crevasses next of Greenland, and dropping sometimes a mile or two down to the rock at the bottom of Greenland. And that is the lubricant that is moving this immense ice pack towards the oceans on both sides. Next. For some reason, there's been no data generated since 2017. You'll have to figure that one out. But this is the NOAA data until 2016. And Greenland has lost 3,700 gigatons of ice. And look at that number, 281 gigatons. A gigaton is a billion tons of ice, 281 a year. Well, what the hell's a gigaton? Next. 1 ton, T-O-N-N-E, metric ton, is a cubic meter of water. So there's 1 megaton sitting over Midtown Manhattan, another one over Uptown. And 281 gigatons is more water than's coming out of the Hudson River on a year as well. So the quantity of pure, fresh, 200,000-year-old water, extraordinarily high quality water pouring into the oceans and then dissolving into it is both raising the level of the sea level, and the overall heating of the oceans means that we're looking at sea level rise as well. And this is sort of happened in our lifetimes, but it's really going to happen in Austin's child's lifetime. Next, please. I started about that fire and the experience of wildfires. I will tell you, 20 years ago, we all talked about wildfires. We even thought about maybe it would affect the electrical systems, but the shock to our personal awareness was just how much wildfires have changed the consciousness just in the state of California. And the gentleman from CEC, the Energy Commission, this is the reality of your lives, I know. This is a Proceedings of the National Academy of Sciences estimate of the wildfire number of acres burned in the Western US since 1984. And you can see the contribution of the increased wildfire risk. And this is the desiccation of the forest, lower humidity in the summertime, drying, and more violent atmosphere with more wind. Next slide, please. Early in my time at CDC, this is 25 years ago now, we got a call from the coroner in Chicago, and they were reporting people dying of heat waves. And the political authorities there were saying, no, it's not heat waves, it's just some infection. And we dispatched doctors, epidemiologists, CDC did, my center did, up to Chicago. And it turned out that, honest to God, one of the most frightening things you can see is to walk up towards the city or county morgue and see freezer trucks one after another next to it. And there were about 700 deaths, largely people who didn't have air conditioning, who were poor, who had their windows nailed shut, who were built in buildings that were designed for winter, but not for summer. And it turns out it was a social catastrophe, but it was also an architectural catastrophe. Next slide, please. This awareness that where things are going with the planet has led the American Academy of Pediatrics to come out with a profound policy. And, you think of them advising on immunizations and such, and here's their policy statement saying, this is going to completely affect our children's lives. A lot of pediatrics, by the way, as Austin knows, is anticipatory guidance. It's telling people, this is what you're going to need to expect, or what you're dealing with now is normal, it's going to go away. Well, unfortunately, this one, climate is not normal, and it's not going to go away. Next. Internists came out with a 19-page document at the same time saying, we want society to do more. Next. The AMA, which is always a little slower than all the specialty societies, came out and said, we've really got to start training doctors and residents and the people coming up that climate change is the reality of their lives. Next, please. A dear friend, Jay Lemery, who's the former head of the Wilderness Medical Society, this is his book, and he was the lead for all the emergency medicine docs to deal with this. And oftentimes they are the leading edge of seeing these problems. Next. Psychologists and psychiatrists, we had the emergency medicine, the Refugee and International Group at my center at CDC, and talk about psychological traumas when 500,000 people have to move because there's no water, no food, or it's become unbearably hot. The psychological impacts almost as profound as the health ones. Next. And of course, the American Public Health Association, full issue of the American Public Health Association, dealing with many attributes of the climate heating and death, both in the US and globally. Next, please. And the most trusted people in health, actually the most trusted people in the United States are nurses, and they have had a very strong advocacy for this as well. So I wouldn't say it, and one of my frustrations was this did not get up to the leadership of the National Academy of Medicine. And I raised hell with them because they had report after report coming out and was always focused on today, and it wasn't focused on the future. And so getting the national academies to really step up was very important. I want to acknowledge Healthcare Without Harm on the leadership on this one, and Robin, your work as well. Next. And this is not going to go away. Our young people in medicine are demanding this. They're demanding changes in their curriculum. They're demanding changes in how the hospitals are being built. There is an urgency that is as medical as could be. Next, please. And the religious leaders are demanding. This is what we're doing to the planet and to our grandchildren is immoral. And the next slide, I think, is the next to last one. Next. So, wait a minute, I want to go back to that one. What, that was the picture of the code blue. And what I'm driving at here is that when code blue is sounded, and unless you cannot leave where you are, you go and pitch in, because unless the patient's got a do not resuscitate, you need to do what you can to turn around the downward trajectory of that person's suffering or even their death. And I think we're at code blue in terms of climate threats to the health of the American people and the people of the planet. And with that, I'll stop. Thank you very much.
Thank you, Dr. Jackson, for that amazing keynote TED-style presentation and putting the challenges that we face in focus. We now turn to Dave Lockhart to consider the California healthcare engineering response to what Dr. Jackson laid out for us. Before he speaks, I'd like to just quickly introduce him. Dave Lockhart is the California Society for Healthcare Engineering immediate past president, sustainability liaison, and Region 9 representative for ASHE. Dave has worked at every level of facility operations, being involved with opening, operating, expanding, and improving facilities operations over the past 28 years. He has a certificate in industrial electricity, an associate degree in mechanical electrical technologies, a bachelor's degree from Sacramento State in vocational education. And Dave obtained the CHFM designation from the American Hospital Association, his certified energy manager certification, and he received the emerging leader recognition and his fellow status with the American Society for Healthcare Engineering. In the very short time I've known Dave, I have found him to be a man of honor and integrity. And Dave, I have to say, I'm really happy that you're here. Thank you for being here. With that said, we'll turn it over to Dave Lockhart.
All right, thank you, Troy, and I'm humbled to be here. Thank you, everybody, again. My name is Dave Lockhart, and I am representing the California Society for Healthcare Engineers as the immediate past president, sustainability liaison, and Region 9 board member of American Society for Healthcare Engineers. For many years, CSHE, as well as ASHE, have been committed to improving healthcare's energy performance, and thus we have made some impressive improvements in our overall performance. Actually, ASHE's Energy to Care program started in collaboration with Mazzetti and their own Scott Wallace as a program lead. For me, I kind of stumbled into healthcare after a tour in the United States Navy as an electrician, then working in the power and emergency generator industry. And after completing the installation of a new generator and transfer switches, I was hired into healthcare. But I was not saving lives. I was just maintaining buildings, making repairs, and trying to ensure the safety of all the occupants of our buildings. As I developed and advanced in my career, I often asked myself, what is my purpose? How can I make a difference? With the Energy to Care program, energy performance became a measurement, a challenge, and even better yet, a competition. I was instantly intrigued in this challenge, but more importantly, the opportunity to make a difference for my organization and my community. As a sustainability liaison, CSHE has demonstrated and led the nation in energy reduction. With 3 large chapter challenge wins, with last year being a back-to-back win. Last year alone, we had 134 facilities in California participating in the Energy to Care program. And with 100 of them obtaining the Energy to Care award of at least 10% reduction in their energy performance over the past year. Just to note, the Energy to Care program overall currently has 3,600 facilities participating and has saved around $550 million, allowing resources to go back to patient care. These accomplishments are impressive. However, they do not include the majority of our healthcare facilities within our state, or more importantly, when you truly look at our performance, we're still doing harm to our communities. Today, healthcare represents almost 20% of the US national economy, 10% of US carbon emissions, and 5% of global carbon emissions, and growing. Rather than doing no harm, healthcare is actively fueling the carbon fire. By reducing on-site combustion, we can make a difference. So today, we are here to discuss a deeper, more impacting measurement than just energy conservation and performance. Today, we want to start the conversation of doing no harm. Yes, doing no harm to our communities and our environment. Healthcare is meant to promote health and not do harm. In providing healthcare, we are emitting a lot of carbon. This has demonstrably bad health effects. We need to fix this so we do no harm. Dick Jackson had a powerful presentation, an important message from clinicians that we need our help. The California Society of Healthcare Engineers and the State of California Energy Commission need to heed this call and take a proper leadership role. We need to make a difference. The healthcare engineering and facility community need to take lead on this opportunity. We have this opportunity through decarb healthcare to make a difference. Let's solve the reasons we think we can't, and together come up with the techniques and technologies we need. Not just those of us on this call today, but you and your network. Who do you know that loves a good challenge? Someone who is passionate about making a difference. Just at the end of last year, I had the privilege of working with John Griffith with Contact CA and Yvette Torres of OSHPOD in producing a white paper on microgrids for healthcare. What an amazing experience that was. So much that I want to share an example of what a team can accomplish. First of all, I have to highlight the power of the healthcare network and the passionate people who want to make a difference. We had 48 people attend our first development meeting, and 26, more than half of them, worked on authoring a paper. Then, less than 3 months, this group produced a 60+ page white paper for OSHPOD on why we need microgrids in healthcare and how to get there. This was an impressive and humbling experience. And that was only on microgrids. The change we need to create together is possible. Look at the change that occurred in 2020 alone. Yes, we were forced into these changes for our own health and safety. But before last year, telehealth was looked at as unprofessional and insensitive. Remote workers, unproductive and disconnected. Look how we're meeting today. A year ago, we would have driven to a meeting place in an additional conditioned building to talk about this challenge. We can make a difference. The California Energy Commission, supported by healthcare consulting firm Mazzetti, is creating a community to share best-in-class thinking towards reducing carbon emissions. Ultimately, we are building a living guidebook from which all California hospitals can benefit, addressing our most challenging questions. How can we reduce the use of steam? Can the codes be changed? Can we optimize the building? Can we optimize the building to use less energy? More importantly, how do we pay for it? How do we get our leadership to support what is necessary? Those are big questions that we really need and we are challenged with. In closing, become a member of this robust community. Healthcare engineers, designers, facility personnel, financial and regulation experts, and more. Help us tackle the greatest challenges facing the healthcare sector toward achieving carbon neutrality. Share your expertise, share your experience, share your passion to help us build a better, more sustainable healthcare industry. Thank you for your precious time. And now I'd like to turn it over to Cassidy Thomas with Mazzetti.
Excellent. Dave, thank you so much for that presentation. I I was struck by how you said we can make a difference, and how you gave an example of how you were doing that today, and what it means for a team to come together and tackle a challenging project. Right now, we get to hear from Cassidy Thompson, who's going to speak to us about the how we'll take decarb healthcare and work together to create this difference we want to see in our world. Cassidy?
Thank you, Troy. My name is Cassidy Thompson, and I am a mechanical designer at Mazzetti and the project manager for this grant. So I'm sure a lot of you are wondering how we plan to accomplish this lofty goal of decarbonizing healthcare. Over the next 3 years, we hope to not only collect ideas on how to decarbonize, but to put those ideas into action. As you can see from this diagram on the screen, there are two sort of phases to this project. The first is on the left side of the diagram. We want to crowdsource information and ideas on the technology that it takes to decarbonize. We plan to do that by using both this workshop series and our online platform, Decarb Healthcare, which Austin mentioned earlier. Through the workshops and our online platform, we want to cultivate a community of people in California and beyond who are interested in this goal of decarbonizing healthcare. We want perspectives and suggestions from all aspects of the healthcare and engineering industries, owners, building managers, designers, code regulators, and more. And as information and ideas are collected, it will be translated into articles and tools that building owners and engineers can use to discover what the best solutions for their facility are to decarbonize. The second phase of the project, on the right side of the diagram, will focus on how we can motivate people and organizations to implement these technologies. We will again host a series of workshops to facilitate discussion on ways to engage the community and put these ideas into action. We understand that information alone is not enough. We need to determine how we can make these ideas and technology real and implementable now. Ultimately, the online platform Decarb Healthcare will act as the guidebook, a living resource and continuously evolving collection of content and discussion that people can go back to and add on to as we continue to develop and make progress on our goals of decarbonizing healthcare. We look forward to hearing from all of you, both in the upcoming workshops and in our online community. This is our community, everyone here, and in support of decarbonizing healthcare everywhere, and we can only do it together.
Great. Awesome, Cassidy, thank you so much for giving us that overview and sharing this diagram of how we might go on this decarbonizing healthcare journey together. Now, I recognize that we are creating a guidebook, a physical implementer artifact that we believe hospitals can, should, and will use in order to decarbonize healthcare and ultimately help healthcare meet its obligation to reduce carbon emissions. But this project is about more than a physical guidebook. And so what we are trying to do is create what I like to call a movement that starts with us 101 people on this call, but extends to others who can together go on a journey to decarbonize healthcare. At the center of that movement is this online platform. We call it Decarb Healthcare. And indeed, almost all of you have already signed up on that platform when you registered for this first kickoff workshop. On my screen right now, you see the current homepage for Decarb Healthcare, which is a work that is being developed. And in the immediate future, we are going to launch the Decarb Healthcare community. It's undergoing final testing right now. And so I'm going to stop sharing my screen for a moment and quickly show you some of Decarb Healthcare. So here is the soft launch of the Decarb Healthcare online community. Right? So what we want to do is create a place and a space where your energy, your ideas, your experiences, your challenges, and your triumphs can help other people in different places, in different roles, and in different organizations to also go along on the decarb journey. And so what we are developing is this online platform and hub in order to do just that. This is a quick demonstration. In a few days, you will have access to this online community, and the type of questions that you see right now being asked in the chat that only happen during our workshops will be able to happen at any time. So when you wake up at 3 o'clock in the morning and you're wondering, is there a way to reduce the steam used for my central sterile? You can ask that question, and somebody from this expanding community will be able to answer that question. Mazzetti and others will reach out to hear your experiences and share them on this platform. So if you've come up with an innovative solution, we will listen to it. We'll create a case study or a video, and you'll be able to share that with this community to get feedback, to get support, to build on each other's ideas, and ultimately create this movement that can drive us forward. Here's Decarb Healthcare on my screen. Very quickly, you can see there are topics here: minimize reheat, central plant, codes and regulations, financial strategies, and the opportunity to suggest new topics. You can search or you can post along these topics. You can also quickly post a question. For example, you might be able to post a question that says, how quickly do you think we can decarbonize an existing hospital in California? So you can ask this question, right? And that question will go out on this platform to the community. In the future, you'll be able to take polls if we ask them. You'll see there's already questions on here. For example, questions about power fuel cells, question about hydrogen. Importantly, you have the option to follow the topics and the posts that you are most interested in. So you can cater this so that it follows along with your interests. You don't need to be bombarded, but you can set the criteria so that you're following the conversations that you want to, and you can silence the conversations that you don't want to follow. So if there's an invigorating conversation going on around, for example, how to design a VAV system in a hospital, you can engage there. If you have created a new idea, or if you have a good experience that has helped you decarbonize, you can push that experience to this community so that this community has the opportunity to take that idea and try it out in their context. In other words, the sky is the limit for how we can interact together to help decarbonize healthcare. But ultimately, decarb healthcare is just a tool. It's a tool that is meant to make our communication pathways easier. But ultimately, what we are talking about with decarb healthcare is folks from different organizations and different companies, frankly, from different industries, from engineers to pediatricians to other professionals who are coming together and using our knowledge to first identify the solutions that we need. That's the community side. And then to take those solutions and share them with the community. That's the guidebook and solution center side. And so we are excited about Decarb Healthcare as a platform to help make this happen, to share experiences, case studies, videos, and to ultimately vet solutions. And you will receive the official launch in the coming days. And with that, for a moment, we are going to open it up to questions. So I'll encourage you to share questions in the chat. So obviously we have our great keynote speakers, Dr. Dick Jackson and David Lockhart. We'll be able to ask them questions, or you can ask any questions about how the decarb movement might move forward.
Troy, this is Jessica. Can you hear me?
Yes, go ahead, Jess. Oh, Jess, are you there?
Troy, I think she was going to mention that we have a couple questions in the chat already.
That's right.
Great. Jess, do you want to go ahead and field those questions?
Sure. We have a question. I apologize. I hear the double audio at the moment. Can you hear me?
Yeah, we can. Go ahead, Jess.
Okay. We had a question that came up. Has anyone done an all-electric central sterile department? Does this increase the number of sterilizers required, smaller chambers in each sterilizer, and thus change the typical area required for this department?
Great. Well, let's start on that answer with David Lockhart, and then we'll open it up to others.
Yeah, great question, and that's a no. We have not gone all electric in any of our cell processing and sterilization yet. A lot of the sterilizers today definitely want clean steam. And so when we're generating secondary steam for the sterilizers, it's often electric, but we have not gotten there yet. And, you know, in preparation for this, you know, I was talking with Troy and the team in regards to just the thought of going full electric. And I think it was Dan with UC Davis and the work they're doing and their Irvine new building there going all electric. Being an electrician by trade, the thought of full electric, just the efficiencies, the challenges, it really does kind of blow one's mind in the physical environments. But definitely some opportunities there. And again, I think when we look at efficiencies, when we look at again, another huge thing in healthcare that's advanced over the last just few years. You come into one of our facilities with a total hip replacement and you're going home same day. A knee replacement, you're going home same day. So there's a lot of things that our footprint and what we're doing in the healthcare environment is advancing exponentially. And so I think the possibility is definitely there and something to look at, but nothing I know of as of right yet.
Great. Dave, thank you so much. And this is the perfect segue. I'm going to put Jim Crabb on the spot for a moment, and then we're going to segue to Dave Mason. So Jim, and then I'll introduce Dave.
So for those of you who don't know me, I'm actually sitting in Georgia, and we did a hospital here. I want to say it opened 5 years ago. That is an all-electric hospital, almost. It's a ground source heat pump system that does all the heating for the building. So no fossil fuels burned to heat the building or make domestic hot water. What that means is that the central sterile department was done at all electric with electric steam generators. Now that's not really the path we're really after. In California, that's still pretty good because the grid is so clean there. In Georgia, the grid here uses about twice as much carbon per megawatt hour as California, other places more. But it is possible to do a building that is all electric. The only gas used in this hospital is for the kitchen, which obviously could have been eliminated very easily, but that was not an engineer's choice.
Great. Well, Jim, thank you for sharing that that example out of the great state of Georgia. And I think that's a good segue into hearing from David Mason. So David Mason is the Senior Mechanical and Technical Lead for OSHBOD and has been so for about 8 years. And he has 23 years working for the state for multiple departments, mostly design work for CAL FIRE. and the Department of General Services. He started his engineering career as an aircraft stress analysis engineer for Boeing commercial aircraft. He is a Cal Poly and SLO graduate. We are really excited to hear from Dave, especially as in his role as senior mechanical and technical lead for OSHPD. And so without further ado, Dave Mason.
Great. Thank you very much. Can you guys hear me? Good. It's been I see nodding heads. It's been one of those days of some glitches. So I was in a webinar. I was presenting a webinar and answering questions that went on and on. So I'm sorry I'm late. I was excited to get to meet with you guys and chat with you a little bit. And so since I missed what was happening early on, I understand there was a presentation regarding the South Bay project and research that was done by Kaiser. Was that discussed earlier in this meeting? Was not? Okay, good. All right, that's fine. Yeah, so I know that I was needed to chime in here today to kind of give you our perspective on some of the stuff we're trying to do with this group of folks, coming from the perspective of an AHJ, which is what we are at OSHPD. You know, we're the state's building department for hospitals, and it's just about all we are. The term I use around the office to explain what we do is sticks and bricks. We monitor and enforce code minimums, and that's all we do. Now, we are occasionally approached by some of our colleagues at Mazzetti and Kaiser and other healthcare providers and designers to try different things to decarb healthcare facilities and increase efficiency in facilities in California. And you know, I find these efforts very interesting. And the only thing that we really hang our hat on at OSHPD, so you know, is code minimums. We like different things being tried. We're currently working with very closely with the Energy Commission as far as energy consumption and energy efficiency and even renewables. So we encourage any kind of different approach being used, as long as the code minimums, especially me as a mechanical, the code minimums are there based on established and agreed upon national standard infection control related issues. So we just kind of try to hold people to that and encourage different approaches going forward to try to make these facilities better in this regard. So, you know, that said, I had a conversation just the other day with a company that uses a German technology in solar thermal. And you know, one of the big things in our facilities, or especially our OSHPD 1 facilities, is reheat. Reheat is a big issue because of all this ventilation that we have to stuff through these facilities. And a while back, I took a tour of a really nice solar thermal installation at a very large fitness facility up in El Dorado Hills, right near Folsom. And they had solar thermal, and they had thermal storage, all this on the roof. And I looked at that and I thought, well, you know, what would be the possibilities of putting a system like this up to supply the reheat, or at least supplement reheat. I think it may have some potential. I've not had the time to sit there with my calculator and pencil like I like to do and run numbers on it. But I wanted to throw that out there, thinking it's something worthy of some consideration and analysis moving forward, maybe. So I mentioned it because I'm surprised I haven't seen it. So, but that's hopefully I'm adding to the value of this meeting today with what I just said, and you know, I welcome any questions or concerns, and let me know what I can do to help, what we can do to help at OSHPD.
Great, excellent, David. Thank you so much for that presentation and for putting your role and the role of OSHPD in that light. We have a few moments left, so let's start off with questions for our keynotes. So Dr. Jackson, Dave Lockhart, or Dave Mason. And so I'm actually going to try something a little bit different. There's lots of things flowing in the chat. If you have a question and you'd like to ask it out loud, Jess, if you're on, you might have to help me here. Go ahead and raise your hand, and we'll get your question to Dr. Jackson, Dave, or Dave. All right, seeing no hands raised, let's extend it beyond our keynotes. So if you have a question for anybody who is presented today, you can share it either by raising your hand or in the chat. I do see a question for you, Dave, in the chat. How would OSHPD permit a solar thermal system, and how would this impact boiler requirements?
Yeah, well, that's a great question. You know, we're concerned mainly with how, in this case, the solar thermal that I was discussing would be for reheat. We don't have much in the way of requirements, if anything, about OSHPD specific stuff for reheat. So how would we permit a solar thermal system? We would just be looking for a code compliant design that's well done, and that would be about it. You know, one of the concerns that will come up, for example, this is outside of my area, but if you talk about solar thermal and thermal storage on top of a roof, obviously you've got seismic concerns there, and we're, as you know, we're pretty tight on that stuff. So that would require some calculations and engineering. But I think thinking about it, I don't think it would be hard for us to permit solar thermal for reheat. A while back, I actually did an AMC that even used geothermal as the backup hot water source for a facility up in the Alturas area. So we're just looking for effectiveness and safety, and that's it, really. I hope I answered your question, Walt. Tamara had a good comment. Solar thermal does have challenges with the real estate. That's true, versus photovoltaics and maintenance certainly too. And you know, another problem with solar thermal throughout history, really, and I remember seeing it many years ago when I was a kid. One of my friend's fathers had a solar company back in the 70s, and even going forward, there's been a lack of good engineering in solar thermal, and that's really, I think that really hindered the industry in America versus what you're seeing in Europe. It's my understanding solar thermal is used in Europe in medical facilities. Takes good engineering, of course, like anything else that we're all doing. So,
all right, David, thank you for that response. We have about 3 minutes left, and so I wanted to highlight a couple of things. So the first is that this meeting is a kickoff and was meant to be a kickoff. It was meant to share some of the direction where we are going, but it is the beginning of our journey. And you already see in the chat several technical questions and challenges and solutions and conversations are happening. The goal of this workshop is to spark those type of conversations. In a few days, those conversations can continue on decarb healthcare once the decarb healthcare community is open and live. And we also have a series of technical workshops coming up. So there'll be a workshop approximately every 2 weeks. The format for the workshop is very simple. We'll have a quick presentation or panel discussion at the beginning, TED style, just like you heard from our keynote speakers today. Those presentations are meant to spark our thinking. And at that point, we will break into breakout rooms where you'll have the opportunity to brainstorm and ideate and share your experiences and really build on the details of those specific insights that you had during the panel discussion and the experience that you brought from your entire years of experience. So for example, the next workshop is reduce loads through building optimization. I believe we will hear from Travis English from Kaiser, as well as one other secret presenter. They'll present quickly. We'll break out into breakout rooms, and we'll hear about your experiences with doing this. We'll work together to form new ideas. We'll identify barriers, and we'll find solutions to overcome those barriers in the breakout room. Then we'll come back together and have a larger conversation. We recognize the conversation even in that breakout room where you'll be able to participate vigorously will just be a start. And that conversation can continue on decarb healthcare. Ultimately, we want to take your knowledge, your talent, your ability, your energy, and your ideas and fuse it with others in this community so that we can make a difference. Leaving this workshop, I think there's a couple of things you can do. You can share the information about this community with others. You can share the word about these future workshops, and you can start to share ideas. On behalf of everybody who presented today, I want to thank you for being here and for joining in this journey. We look forward to having you join us on decarbhealthcare.com and join us at our upcoming workshops. You'll hear more from us in the near future. Have a great day and take care. Bye-bye.